Did you know that about 45% of all the actions you take in a day are habits, not decisions? When it comes to improving our health, a lot of it comes down to something very small. People like you and me creating healthier habits. But how do we do that? Health is Wealth is presented by Meridian Health Services with support from Lifestream Services. Welcome to this live episode of Health is Wealth. I'm your host, Paul Brown, and I'm joined by three special guests who I'll introduce in a moment. Health is Wealth began as a YouTube series, and if you've seen Health is Wealth before, thanks for joining me again. Tonight we're live, so it feels a little different, and it feels different for me too. But the topics will feel familiar. If this is your first time watching, I'm so glad you're here with us, and you can always go back and watch the whole Health is Wealth series on the Ball State PBS YouTube channel. Now, let me introduce you to the stars of the show this evening, the experts joining me tonight. If you've watched Health is Wealth before, you might recognize Lisa Rosine. She's the Executive Director of Recovery Cafe Muncie. Lisa has a bachelor's degree in psychology from Michigan State University. She's a certified alcohol and drug addiction consultant and a peer recovery coach. And she's also in long-term recovery from substance use disorder herself. Lisa, thanks for joining us tonight.
Thanks for having me.
Dr. Sarfraz Khan is Chief Medical Officer, Vice President of Medical Affairs, and Medical Director of Psychiatric Services for Meridian Health Services. He's an adjunct clinical professor of psychiatry at the IU School of Medicine and clinical associate professor at Marian University of Osteopathic Medicine. Dr. Khan, thanks for joining us.
Thanks for having me.
And Dr. Catherine Marsteller is the Primary Care Division Chair for Meridian Health Services, and she practices the specialty of internal medicine, including preventive care and treating conditions like diabetes and high blood pressure. She's practiced in Richmond, Indiana for the past 13 years. Dr. Marsteller, thanks for joining us.
Thank you.
So we've talked quite a bit in the Health is Wealth YouTube series about the roles that habits play in our health. And a concept that I refer to over and over again in the series is Keystone Habits. It's a term coined by Charles Duhigg in this book, The Power of Habit. And basically he says when you want to make a change in your life, like becoming healthier, keystone habits are the best place to start, because when you change a keystone habit, it makes other habits easier to change. And you can learn more about that in episode 2 of Health is Wealth on the Ball State PBS YouTube channel. Lisa, when we talked for that episode, you talked to me about intentional breathing and how impactful that's been for your life. Can you talk to us a little bit about that habit for viewers that didn't see that, and how has that habit helped to make other positive changes easier in your life?
Yeah, so it's actually made this experience here a little more at ease. I learned this skill through treatment for my substance use disorder. And I learned that when I can take control of my breathing, I can actually trick my body into believing that I'm safe and that I don't need to fight or flight right now. And that allows me to have a clear thoughts and make better choices. And so knowing that is one thing, but doing that is another. And so if I could set goals to take time, like 10 seconds, 1 minute, 10 minutes, to take intentional breaths in various patterns, and then do it, it feels like I have achieved my goal and I have the physiological effect of feeling more calm. So it's kind of a twofold reward.
Yeah, thank you. Thanks for sharing that with us. Over the last few weeks, we asked you, our Ball State PBS viewers, to send in questions for our guests. And tonight I'm going to be asking some of those questions that you've sent in. And I'm going to direct this first one to Dr. Khan. When starting to develop a keystone habit, Is it better to have lots of immediate short-term goals or one longer goal?
Before I answered precisely, I would say what a habit is. A habit is a repetitive action which you get secondary to a cue, and that leads to a performance which you wanted to have. So that's what a habit is. You traditionally try to break those habits which you believe are not best for you. That may be something as bad as smoking or drinking or being in something which you never preferred. Even that may be eating unhealthy. When it comes to breaking a habit, a lot depends on how you try to look at life. When you don't get something, are you among those who sometimes consider, well, did I fail? It's always good to have a long-term goal. So let's say your long-term goal is, I'm going to lose 40 pounds. But then go with short-term goals. One would be next 2 weeks, I'm going to avoid Coke or juices or limit it to just once a week. And second one will be, by the end of this week, I would have lost a pound. Or I'm smoking, but instead of smoking 20 cigarettes in the next week, I'm going to cut down to 19. So small goals which eventually leads to a bigger one. For many of us, if we try to go to a bigger goal, in many situations, either we fail or we don't achieve, and we go back to rebreathe, get ready, and come back.
Yeah. Dr. Marsteller, you specialize in internal medicine.
Yes.
For those in our audience who are not familiar with that term, can you give a little bit of an explanation of what is included in internal medicine?
Yes. So internal medicine is the practice of, I would say it's general internal medicine. It's different from family medicine, which includes all ages from baby to adult. Internal medicine is more 18 and older. So I treat adults 18 and older. I practice preventive medicine, and I treat general diseases such as cardiac disease, hypertension, diabetes, women's health, GYN, and a lot of acute diseases. So it's more, they call it adult medicine, so 18 and over.
Yeah, that is a broad range.
Yeah.
In our episode about Keystone Habits, I said that some Keystone Habits help by building momentum. You might have heard this called snowballing or small wins, a lot like what Dr. Khan shared a minute ago, helping us build towards that bigger goal. And Dr. Marsteller, in your practice, I imagine you have lots of conversations with patients who are trying to develop new habits or break bad habits. So next question comes to you. Why is it important to see a quick win in developing a habit?
Quick wins are important because it gives momentum, it gives encouragement, it shows that you can do it. I think it gives confidence too, and it allows the patient to know that, hey, I've got this. I can actually accomplish it, and it encourages them to continue to keep going. So I do like to. So when a patient comes in and they've, say they've lost 5 pounds, I tell them, see, you're already doing it. You're already doing it, and that just they leave happy.
Yeah. Lisa, you're the executive director of Recovery Cafe Muncie. Again, for folks who may not be familiar with the organization, could you give us a brief overview of Recovery Cafe and what's a typical day like there?
Yeah, so Recovery Cafe Muncie is one of many cafes throughout the nation. It's actually part of a network of recovery cafes. So there's over 60 across the nation. And we are a peer-based community of people who are in recovery from anything. So anything that's keeping someone from thriving, that can be substance use disorder, mental illness, poverty, domestic violence, hunger, anything that's causing trauma in someone's life. We believe that finding safety and finding other people who can understand what that struggle is like can help hold us accountable to making big changes in our life. So we provide a free meal, free coffee. We have lots of games and activities. We have a recovery circle every day that we're open. We have social events, and we have skill building classes. And we also have peer recovery coaches who came in as a guest at one time, became a member, became a companion, became a member leader, and became a recovery coach. And so we are all about setting these small goals and then taking that back around to the next person and helping them doing the same.
Yeah, and I remember when I talked to you for a previous episode, one of the things you mentioned to me was that we're all in recovery for something, right? And I think that was kind of a new concept for me, and I wondered if you could elaborate a little bit on that. You know, you say everyone is recovering from something. What do you mean by that?
We're all human. I mean, it is not easy being a human, and there are challenges for every single person. And I think that if we can take an inventory of what is it that I'm struggling with, what is it that I wish to change, or would like what's a goal that I have for myself, I think if we can see ourselves as a work in progress, it helps us have compassion and empathy for other people who may have worse or bigger, more apparent struggles that they're working with.
I'm going to ask you a similar question, or actually the same question that I just asked Dr. Marsteller. You know, you're interacting with a lot of folks who are in recovery, and they're trying to create those new habits, put a new habit into action. So, as you've seen that day to day, why is it important to see that quick win when you're trying to start a new habit?
Dopamine. I mean, it's just, it's just like a drug. You know, the faster the response of a drug, the more addictive it is. And so the faster a response of a win, the more rewarding it is. And so the more I'm going to want to do that again. But if I have to wait to achieve this goal, that's like a extended release, you know. And so that's not as rewarding. That's not going to make me want to act again quickly.
Dr. Kahn, could I ask you to elaborate a little bit on what Lisa said about dopamine and the way that works in habits when we are creating a new habit or trying to break a bad habit? What role does dopamine play in the brain in that?
Dopamine is a very important chemical in our brain. That's a chemical which gives us happiness, a nice meal, some other things, decent exercise, meeting your family, that gives you dopamine. That's why we would like to do more and more and more. Contrary to that, when people use drugs, they use dopamine. That gives them happiness. And the only problem is a regular happiness brings back dopamine in a few hours. The use of drugs to bring the unnatural happiness, it really cannot go back, so the body has to work. When it comes to habits, it's very important that knowing what is good for you does improve dopamine. Meeting your family, it does give dopamine. If you try to do something destructive, as a rule, it does not. It has some other things. So what was mentioned by Lisa was a very important point, that it's all about dopamine. This is how you develop habits. This is how you get a victory in your habits, because you know this is something which is going to make you feel better. If you don't, just remember a nice workout and how great you feel out after that, because you know the dopamine is up.
One of the interesting things that I learned as we were working on the Health is Wealth series, I was talking to Jenna Ashby from the 812 Coalition, and talking about kind of how do we make change as a neighborhood, right, beyond just the individual. And she said that they boarded up the doors and windows of the abandoned houses in their neighborhood, and they painted, flowers and cats and things in the window. And she said that was kind of a small win, a quick win for their whole neighborhood, where folks started to see, hey, we're making progress here. It may not be a big thing all at once, but we're making that small progress. And then it helps people to think of what can the next step be. Now that we've made this change in our neighborhood, what's the next step? And that was really really impactful for them, and I thought really thought-provoking as I was thinking about the way that's affected the 812 Coalition's area of Muncie. Two of our guests tonight are with Meridian Health Services, and they recently got a new president and CEO. Seth Warren joined the organization last August, and he sat down with the general manager of Ball State Public Media, Phil Hoffman, to talk about his background and his perspective on healthcare in our community.
Okay, well, let's start with, sort of you arriving here. What drew you to Meridian and East Central Indiana?
I had a couple people reach out to me and say, hey, Hank Milius, my predecessor, is retiring, and they thought, this is a good fit for me. They said, you might want to check out this opportunity because we think that what you're looking for and what Meridian has to offer would be a really good fit. So I decided to reach back out to the search firm and throw my hat in the ring, and had come up here and met with Hank. And Hank sort of laid out what Meridian is, what they've been doing, some of the growth plans, and I walked out here very intrigued. And I think that a lot of what Meridian has to offer did appeal to me. I've been in the healthcare industry for well over 30 years and was looking for something different. I have a son that has some mental health issues and some substance abuse issues with alcohol, and I thought, how can I help people like my son? And what Meridian does just really jived with what I wanted to do next. And so as I explored it, I felt like this was the right fit for me.
That's got to be a little bit daunting. Those are big shoes to fill, right?
Yes,
like
absolutely.
Hank, I mean, good heavens, the growth of Meridian over the years, it's a lot. Right?
Yes. What we want to continue to do is expand our footprint because there is so much unmet need out there. There is need from a primary care standpoint, there's a need from mental health, and unfortunately, both those numbers keep rising. And so we want to grow our footprint, continue to offer the things that we have been offering, but then within the communities we've already been serving, grow and meet the needs.
Do you see partnerships or opportunities that you plan to kind of pursue in the future that you think there's a need here? Is there things that you're...
Absolutely. We've been partnering with a lot of health systems throughout the state. For instance, just using Franciscan as an example, we took over a behavioral health practice in the Indianapolis and Mooresville markets, and we were able then to embed primary care in that practice. So we're going to continue to look at expansion of opportunities with various healthcare systems, but then also partnering with the communities. I'm very excited to announce that we're going to be doing a partnership with the city of Muncie with their crisis center. So we're actually going to be running the crisis center and staffing the crisis center. So we're really excited about that partnership opportunity with the city and meeting the needs of the community, of the greater Muncie community.
And like you said earlier, the mental health needs, especially in the last few years, I don't know if it's more than it has been in the past or if it's just more apparent now after the pandemic. People are more aware of it, but it seems like that's a really burgeoning area of need, right?
It is, and I think it's a little bit of both. I think that people are more willing to talk about it. It doesn't have the stigma attached to it once did, and I talked early on about my son that has some mental health issues. I think it's important for people to talk about the same way you would talk about if your child had diabetes or cancer, is to talk about mental health issues or substance abuse issues, because it's always been the dirty little secret that we didn't talk about. And I think by exposing it and being able to talk about it very openly, helps us accept it as a true health condition and be able to address the needs.
What do you see specifically Meridian's opportunities in this area of mental health? Where do you see like the key things that you really want to focus on in the next few years?
Sure. What we've done is we've embedded our primary care practice and mental health and behavioral health services together so that it is seamless. We talk about how we do whole person health, and it's the mental health, it's the physical health, and it's the social health. And it's trying to identify what the root causes are. For instance, our dentistry services, when a patient comes in, they're taking their blood pressure. I dare say most of us, when we go to a dentist, we're not having our blood pressure taken, but we're trying to identify, are there any physical health issues that you're unaware of? We do a depression screening. And again, for dentists to do a depression screening is atypical. So we're looking at opportunities to blend primary care and the mental health. We're more than just mental health services. We certainly consider that a key part of what it is that we do, but we are a provider of healthcare. And again, that's addressing social needs, physical needs, and mental needs.
Well, Seth, thank you for joining us.
Certainly.
We appreciate your time. Thank you for all that you and the team at Meridian do for the community. We appreciate it.
Absolutely, and we are very happy to be a part of the community, and we have great employees, great staff that are providing great care out there. So I want to recognize all of them because they're on the front line. They are the ones dealing with that, and I think kudos to them rather than to me is important.
Thank you, Seth.
Thank you.
Welcome back to Health is Wealth. Dr. Marsteller, you're one of those frontline providers that Seth was just talking about, and I know you chose to work at Meridian because of the philosophy of whole person health. And you know, Seth was talking about the relationship between mental health, physical health, mind and body. What is the connection between mind and body in terms of health, and maybe more specifically about building healthy habits?
Yes, I mean, that is definitely something that I see every day as far as the mind and body. I'll have patients coming in with high blood pressure, headaches, and a lot of times it's not the high blood pressure or the headache, it's, you know, what's really going on in your everyday life, and it's usually stress related. And oftentimes we'll get to something that's very personal that's bothering them, and I tell them, I'll say, look, you need to manage whatever it is that's going on. You have to face this issue. Sometimes it's a personal issue, a work issue. You need to go through that because it is now manifesting physically. You know, your blood pressure is not controlled, your diabetes is not controlled. You're having these headaches every day because you're not managing that problem well. We do have the nice advantage at Meridian where we can do what's called a warm handoff, where they can speak with either a community health worker or a therapist that allows me to move on to the next patient, and they are able to handle those more personal problems so that the next time that I do see them, those are managed well, and therefore their medical problems are managed a lot better. And sometimes it's nice because they hold it inside, and they'll have that kind of that eureka moment, and then you'll see them just kind of melt. You know, like they'll break down and they'll be like, yes, this is what's really been bothering me, and it's, you know, they're grateful. They're grateful.
Do you mind speaking a little more to that warm handoff? Because
Yes.
It seems like that is a very key part of that is the personal connection.
It is.
And not having to, you know, get on the phone to find someone to address that. Talk a little more about why that's so important.
It is important because if you don't catch them in that moment, you'll sometimes miss that opportunity, and they won't talk about it again, because that's the point where they're vulnerable and they're open to accepting the help. So it is nice to catch them, and that's when they're open to accepting and admitting that, hey, yeah, this is a problem, this is something that's been bothering me for maybe a couple of years, and they're finally admitting it.
We talked earlier about how Keystone Habits can create momentum towards other habits through small wins. Another way that Keystone Habits can help us achieve other habits is by creating awareness of other habits. For example, keeping a food journal could help me see where there's room for improvement in my dietary habits. And there is room for improvement there. Dr. Marsteller, so much of our daily activity is habits. Often we don't even know that those habits are there because we just aren't aware of them. When you're interacting with your patients, what do you recommend, or how do you help them to become more aware of that day-to-day?
Yeah, I try to tell them to start recognizing maybe their triggers, and hopefully being more aware and becoming aware of the trigger so that they, instead of reacting to it, making a conscious decision to make a different choice and not necessarily react and make the healthier decision, if that makes sense. Mm-hmm. Yeah, it's not easy. I know it's not easy to do. You have to create a new loop.
Yeah. Dr. Khan, a viewer sent in this question, and I'm going to pass this to you. How long does it take for a new habit to take hold and become your new routine?
Traditionally, there's a rule of 3 which we have been reading all over, and it's on the internet and some books, like 21 days. That's more of a myth because every human being is different. So what Tom can do, Harry may not be able to do it, and what Harry can do it, Sally may not be able to do it. So traditionally, what research tells us, you can develop a new habit somewhere starting from around 18 days to as far as more than 250 days. What's an average? It can be around 66 days. Well, that's one study. Other study may say 54 days, another study may say 60 days. But to develop a healthier habit, it's very important to understand healthier habits are a little hard to develop. Why? Because the amount of dopamine it creates is not going to happen in the short run. If you would like to be seen by somebody and getting a compliment, you look great, you lost weight. That is probably hard work of 3 or 4 months. So in those 3 months, you have to get going. Now, how you get going, that's a challenge. And the challenge is have a few cues with you. One cue would be every morning you weigh yourself. So half a pound down, it gives you the dopamine, which we talked a few minutes ago. Having an apple, standing just on your kitchen table rather than having a cake. So please understand from a generation of the cola, the ice cream, and the cake, taking it back to the healthier habits, that's a process. So to develop a habit, it can be as quick as a few days. It can be as long as maybe 8 months. The important thing is make sure you have the cue to go to that healthy way of life, the choices. And how early you achieve it or how long it takes, as long as you are a winner in the end, you are a winner.
Yeah. And Lisa, whether we're on the short end of that span or the long end, it still feels like forever, right? Mm-hmm. Can you talk to us about what's the importance of surrounding yourself with a community of people who are going to support you on making this change when you've got to get through and you want to achieve that habit, but you need to have people around you and not just be doing it on your own, right?
Yeah, I think there's many reasons why we would need a support group around us. First, I think it's really important to not feel unique, like to feel like I belong somewhere, because my brain can tell me that no one struggles the way I struggle. Nobody wants this chocolate cake more than I want this chocolate cake. Nobody is as whatever. But if I can find like-minded people and belong to that group, that kind of chips away at that idea that I am unique. It also is really important to be held accountable. And so if I say my goal or my intention of a new habit out loud, and I have good, healthy peers around me that want to see me succeed, when I start slipping or making choices that are not aligned with that habit, they can remind me what my intention was, and maybe ask me if that's going to get me the result that I want, and hold me accountable.
And speaking of accountability, I know that's part of what's built into the programming at Recovery Cafe. Can you talk a little bit about how that is part of the process for the folks who are members at Recovery Cafe?
So we practice loving accountability. So to become a member, you commit. And that's a really big, scary word for a lot of people, but you commit to regular attendance at a recovery circle. And a recovery circle is where you can be known. You talk about 3 things. You can go as deep or as surface as you want, but that's what's a challenge you're having, what's a growth you're seeing in yourself, and what's a goal that we can hold you accountable to next week. And we'll check in with you on those things next week. And so they are expected to attend that circle, and if they don't, they're held accountable the next time they try to enter the cafe. We'll say, we missed you, where were you? We'll see you at your next circle. You're not eligible for entry for all the fun and games today. We'll see you at the next circle because we love you and we want to hold you accountable. I think that helps build integrity, dependability, and that's a skill that I think a lot of folks don't even realize that they're capable of.
Dr. Khan, one of the things that Seth Warren touched on in the interview we heard a few minutes ago was the stigma around mental health, changing the stigma, and talking about mental health issues the same way we might talk about diabetes or cancer. Why is it so important to change the stigma around mental health?
Mental health has been a challenge for a very long time. The reason being traditionally the patients of mental health can be called as crazy a while ago. And if somebody would like to know from where the word crazy came, that actually came from delirium, which is the end of life confusion. However, mental health stages and television dramas, the struggles of the life, did put a bit of a negative feeling, bit of a stigma there. It's important to break the stigma because one of us can have an illness on any given day. If you look at the incidence of major depressive disorder, even a mental illness, 1 in 3 of us can have a mental illness at any time. If we do not break the stigma, people will not be able to pull themselves out of that. I think we need to understand a person who struggled and is healthy today is far better than one who could have been better there somewhere. So a living person conquering mental illness is a success as compared to the one who lost his life in this battle. We worked together. Back in approximately 200 years ago in the Europe, when the time of the machines came, people were eating the same what they were eating before and doing work in the fields. And they changed the work, but they did not change the habits. So what happened? Cardiac diseases went up. Then they came to know and they said, you know, we need to make a change. Same thing is here. Stigma is better. Now people come and talk to me. They find me and they tell me, I'm struggling with this, can you suggest a doctor? So we have achieved quite a bit. We have more to achieve because mental illness appears to be affecting us. And if we do not know a storm coming, you know, the storm will very soon overpower us.
And it feels like, you know, maybe the $1 million question, I'm not expecting you to necessarily have the answer, but it feels like with the rising rates of mental health challenges, you know, is it occurring more frequently, or are we just more aware and diagnosing it at a higher rate? Is it both? You know, do you have a sense of that?
Actually, it's a very bright question. Both. Number one, we are knowing it. Before that, we would say somebody's afraid of a dog, and now we know it's a dog phobia, which is a treatable condition. But on the other hand, mental illnesses it's a pandemic. Why so? It is very important for us to know the concept of wisdom, which sometimes we do not pay attention. Wisdom is learning the life and going through the tough times of the life. So if you look back, when everybody should have been depressed, that is the time of the Great Depression. People don't have much to eat, there were a lot of struggles. Still you do not find it because families will stay together. It's very important for us to know that holding the hand of my spouse, of my parents, my children, my siblings is far important than holding a cell phone in my hand. Relationships, remember the time-tested things are very important. We are walking away from the time-tested things. And when you leave a time-tested things, it is replaced with a good thing or a bad thing. And unfortunately, mental health is right there. We are losing a base and we are suffering.
Thank you for sharing that. It seems like it's one of the big challenges in this modern society is the work-life balance, right? We're all, it feels like, trying to juggle that in some way. We had a question sent in on this topic. How can we maintain a healthy work-life balance in the midst of increasing demands of modern society, and what are some strategies to prioritize self-care and well-being?
I can sort of talk on that.
Sure.
I'm definitely not an expert on work-life balance. I have work to do, but I think it kind of goes back to that idea of community. I'm lucky to have a partner who supports what I do as a career, and we have a family together, which I value dearly. And so I state my intentions out loud to him, like, this weekend, I'm not going to talk about work, or I'm not going to check my email until, and if I say it out loud, I'm much more likely to do it. Now, if I do it anyway, or don't do the thing I say I was going to do, whether or not he holds me accountable to that, I don't know. But just saying it out loud, I think really holds a lot of weight. And also, this feels a bit sterile, but I actually block out time on my calendar. I mean, there's no work after this time. This is a protected block right here for family or for hobby, or there's so much more that this is a rich life, and I don't want it to be too messy. And so sometimes I need to create structure to fit time for play in.
Yeah, thank you for sharing that with us. We're a few years away from the 100th birthday of Ball Memorial Hospital. The hospital has changed a lot over the years, but it's still a central part of healthcare in the Muncie community, literally and figuratively. Dr. Jeff Bird, the president of IU Health Ball Memorial Hospital, sat down last week for a conversation with Ball State Public Media General Manager Phil Hoffman.
Let's talk a little bit about, over the years, how the public health needs have changed in your perspective during the time you served here.
Yeah, so, I grew up in Muncie. So, my father was a United Auto worker in one of the local factories. When I was a child, healthcare was, for the middle class in Muncie, very much a insurance-driven kind of situation. So, as the factories closed in town, so did the challenges around healthcare. I've always had some poverty locally, but our poverty levels have dramatically increased. And so I think that's had a really big effect on what in healthcare we call the social determinants of health. All of those things, not medicine and doctor care and hospitalization, all of those things that wrap around to make people healthier or unhealthy.
And as you think about the role that your organization plays in the region, what are your priorities in terms of trying to help solve the biggest challenges in our region right now?
Yeah, so, I've been pretty deeply involved in this whole debate around the cost of healthcare. What's happening technology-wise, what we want to continue to try to do so that people that come to us have the best of everything, and that's a real challenge. My organization, IU Health, has really embarked over the last 5 or 10 years in understanding that these social determinants of health really play a bigger factor in determining an individual's health than how big my hospital is or how many beds I have or even how many physicians and nurses that we have. So we've invested several $100 million in trying to get programs to give access to people, particularly those that are on the fringe of being able to access health care, and give them opportunities just to make good choices and be healthier.
So can we expand a little bit on this social determinants of health?
Sure.
and explain a little bit for the audience what that means?
It's Maslowian hierarchy, right? If you don't have food to eat or a safe place to stay, starting there, when you're worried about your next meal, how you're going to pay your electric bill, it makes it really hard to be thinking futuristically about where my health is, or am I doing all the things that I can do to be as healthy as I can be. As you know, in East Central Indiana, we still have some of the very worst statistical problems with obesity, smoking rates, sedentary lifestyle. And if we can activate people, this goes back to, I'm a family doctor, and I had these conversations all day, every day with my patients about, staying activated, choosing the right foods, keeping the body moving, all that, mind, body, and spirit kind of things that are important to our overall health.
You're coming to the end of your time here as CEO. What would you like to see as the legacy that you leave behind in the time that you still have left at Ball?
That's a really hard question, but when you get to this point in life, it's something that you do think about. And I guess people often say, what are you going to do? well, what I'm going to do instead of working 50 hours at Ball Hospital in our healthcare system, I'm going to work 50 hours out in the community. So again, I love this word activation. I think people want to be healthy. I really do. I'm going to lobby hard to try to get fewer people smoking. I'm going to lobby hard to get youth back involved in staying active, youth sports and other things like that. So I guess I would hope that as a legacy that what we've been able to do to open up access to healthcare, to make people not be intimidated by what we do, to put less emphasis on can I pay my bill today, and more emphasis on I've got to do the right thing by getting to the right place as a consumer of healthcare to be able to get the care that I need. And we're working really hard at establishing a framework of practices in and out of the hospital to make it less intimidating and easier to access so that we can keep people healthy.
Well, thank you for joining us today, Dr.
Thank you. It was a
Bird.
great
We appreciate
pleasure. I
it.
appreciate the opportunity.
Welcome back to Health is Wealth. In the final part of the show tonight, I want to turn our attention from individual health to community health. One of the terms that you heard Dr. Bird talk about in the interview was the phrase social determinants of health. That was a new phrase to me when we were putting this series together, and we talked a lot about it in episode 5 of Health is Wealth, which you can find on the Ball State PBS YouTube page. In that episode, I talked about how the biggest opportunities for improving our community's health outcomes might not be healthcare specifically, but actually these social determinants of health, such as food deserts, educational opportunities, transportation, and many more. One of our viewers sent in a question on this topic and included a really thoughtful analogy. They said, just like remodeling certain areas of your home will add extra value, is there one activity not directly related to healthcare that a community can do that will have a large positive impact on overall health outcomes? So again, the idea is things that are not specifically health related but have a big impact on health. I'd like to have each of you give an idea, if you would, on something that either you've seen done in the community or an idea of what we can do to help turn that around.
I think communication is the key. The more we interact, more we talk, more we try to know the challenges of the life. It is not directly something which is therapeutic as itself, but it has a very big base, just like planting a seed. You plant the seed and you forget about it, and then you came to know that you got some nice apples over a period of time. Same thing is true. What can we do? What changes which we can make to help each other? That's communication, the talk. Just the old-fashioned way of know your neighbor. Just the old-fashioned way of knowing the people who you work with. I think it is a time for us to look back and see we achieved a lot by going to the smartphones, the social media, but maybe it's a time to look back and see what we have lost in this. Human interaction is still the biggest thing which we can receive or which we can give. I think as a community, earlier we understand there's more than something for self, which is our phone, our communication. There's a little bit more around, but unless we choose to explore, we wouldn't get it. And apparently, we have to take a decision. It's our community, our nation, our country.
Lisa, same question to you. Something that isn't directly health related that can help improve the health outcomes in our community?
I would think challenging ourselves to have an inclusive mindset and creating safe spaces for people to exist regardless of whatever baggage they may be bringing with them. Creating space for people to be who they really are and allowing them the space to thrive. And then also when you were talking about communication, the word collaboration came to mind. At Recovery Cafe Muncie, our members were telling us that they had a need for basic necessities. We need clothing. We need food. We're our folks are constantly getting things taken from them, or they're evicted and they have to start over repeatedly. And so we are collaborating with a food bank and with our community to get donations. So we now have a closet and a pantry so that people can come into that safe space, that we are providing this inclusive, holistic space for them, but they're also getting their basic needs. And that's in a lot of ways demonstrating how safe this space is. It's that it's fulfilling that base level hierarchy of need, you know.
Yeah, yeah. Dr. Marsteller?
I'm kind of going on what Lisa has said. Something that I've actually seen done on a small scale in Richmond, where I live, is there's these small projects that I've seen erected about town where, I don't know if you've ever seen people have, these little structures that have books in them. So there's those, but that I've actually seen the structures actually filled with food.
Mm-hmm.
So of course there's food banks, those are the obvious food banks, but there's been ones with food. I have also seen structures where it's almost like a scaffolding, and it says take what you need, and people have put things like coats, gloves, hats.
Mm-hmm.
It's pretty cool actually. So it's something from the community to the community.
Yeah, thanks for sharing those ideas with us. You know, it's hard to have a conversation about healthcare without also talking about cost and access. And so those things are related, but they're not exactly the same. A final question from our audience: how can people overcome barriers to accessing affordable healthcare, particularly in underserved communities, and what initiatives are being implemented to address these disparities locally? So are there ways that you guys are aware of where access and those barriers are being overcome?
Yes.
Yeah.
Sorry. So at the cafe, at Recovery Cafe Muncie, we are very much, we want people to come to where they feel safe, and we want the providers to come to them. So we try very hard to not, here's a referral, here's a phone number. We have Meridian multiple times a week. We have Open Door. We have Aspire to do HIV Hep C testing. We have Vivitrol providers. We have them all come into the cafe to meet the individuals where they already are, because these are individuals who are often kind of hard to pin down otherwise. And so this is a space where they feel safe, and the providers come to them.
Yeah. Do either of you have something?
I know that we have Meridian in schools. We have a Meridian clinic at Richmond High School, and I know that we have also I believe in Muncie as well, in the Muncie schools, so we bring it to the schools.
Yeah, that's great. So the one of the things that that I saw as we were interviewing the folks at Open Door on a similar question, a lot like what you were saying, Lisa, they've got a program called Neighborhood Ambassadors,
Mm-hmm.
where they go to various places around the community, and folks don't have to leave their neighborhood to be able to talk to somebody and get connected to different kinds of care. And so that was a really interesting way of, again, not expecting someone to make that leap on their own, as you guys have touched on already, but kind of that warm handoff maybe in a sense. So like, how can we meet you where you are, mm-hmm. and continue that? So the last thing that I wanted to ask tonight is for folks who are watching who, maybe they know that changing a habit is really hard. Dr. Codd, you've talked about how it is a very hard thing to do. Sometimes it can feel overwhelming. So for someone who's watching who knows that they want to make healthier habits, but are having trouble making that healthy habit stick, and I put myself in that category. Could you share a final piece of advice or some encouragement to help folks to in that journey?
I think all of us try to make healthier habits. All of us have some past which you want to make better, whether that's losing weight, that's healthier habits. It's very important to know, once you know there's something you would like to achieve, you achieve it. And that's basic thing, trust in yourself. But it's equally important for the people around us to know what struggles we have and how we are going to go through those barriers. Having said so, let me change a little bit. Sometimes we are the ones who are trying to help the person next to us. So sometimes we just have to shift the gear. We have to change the seat and said, I need help here, but let me give the same thing back. It's not easy, but it's not hard either. It is just a process. As long as process goes in, we win. And if we do not do that, then as a society, as a community, as a nation, as a country, we regress. This is what we do not want. We need to know what we are doing, trust in yourself, and do it, and success be yours.
Thank you. Lisa, a thought?
A suggestion might be to start with doing something that is kind, something that is benefiting someone else, and to write it down, because when we put pencil to paper, it becomes concrete and less avoidable. So maybe a viewer might find it helpful to write down, like, tomorrow I am going to do this one small kind thing, and maybe don't tell anyone that you did it, and that will have a ripple effect in our community, and it will feel really good to do it.
And that feeling that you get from starting, you know, as you've talked about, that's such a big part of it, isn't it? Yeah.
Yep.
Dr. Marsteller?
I would say set yourself up to be successful. Try to remove the friction. So, like if you want to go to the gym, put the gym clothes in your car so that you go to the gym instead of going home straight from work. Or you want to eat healthy, pack your lunch the night before, so that way you avoid buying the fast food when you're at work. So try to do it so it's easy. Make it easy for you.
Yeah, if I may share, one of the things that I've learned from in doing this series is the importance of the cue. You talked about the cue in a habit, right? And thinking through what's the thing that's leading me into this habit, right? And so if I'm trying to make a new habit, maybe I'm trying to exercise more, doing that at a specific time. So I'm going to do that after dinner, for example. I'm going to go for a walk after dinner, and that way I already have that cue. Dinner finishes, and that's my cue to start my activity. And then the other part of it, which again, this is a little bit of a shameless plug for the Power of Habit that has been kind of influential in putting the first season of Health is Wealth together. Rewards, right? So it's not just a cue, but also a reward. What are you getting out of that activity? And it could be something specific, like maybe seeing the number go down on the scale, but it also could be a feeling that comes from from knowing that you did your goal, right? Lisa, I remember you talked to us about how circling back to intentional breathing, when you achieve that little goal, right? It helps you feel like, hey, I checked that box, right? Gives you that feeling. And so that reward kind of follows. Dr. Khan, if I may, you mentioned cues a few minutes ago. When folks think about a reward and trying to create a new habit, do you have any advice on how to set up a reward for yourself, or what kind of a reward should I look for when I'm trying to create that healthier habit?
Reward can be anything. Reward can be, something as simple as a candy to a child. But for us, the adults, our rewards are different. Our reward, maybe finding somebody who's in need. Maybe making sure that when you go to McDonald's and you choose to pay for the person who's coming behind you. Reward may be something as simple as knocking at the door of your neighbor and finding out what he or she needs, and just a word of thank you. Sometimes we work on ourselves to change the feeling of reward. Just like after getting done with an exam, we would say, you know what, I'm going to watch a movie. It can be different. We can say, after getting done with my exam, I'm just going to feed a homeless person. So when you change the concept of reward in yourself, you take the community to a different level. That would be once you try to reach my age as being a psychiatrist. I'm in that age where I need to give back to the community. That's something all of us need to work on, and it's very important that we teach that to the next generation. The concept of reward, how that helps.
Yeah, it's not just a reward for myself necessarily, but how can that be part of the community as well? So I want to thank you all for coming tonight. Thanks for joining me for this live episode. I know that was a little nerve-wracking even for myself, but a very special show, and I appreciate all three of you guys joining us tonight and sharing your expertise with our viewers. And thank you for joining us tonight. Remember, you can watch the entire first season of Health is Wealth on the Ball State PBS YouTube page. And if you've got ideas for a future episode, write in and let me know. Thanks for watching. I'll see you next time.